Thank you very much. I'm Alex Alscher. I'm founder and CEO of Samedi, the e-health platform as a service in the healthcare sector. And yeah, I'm really happy to be here. Thanks for the invitation, Marco. And yeah, I give you a short journey of what we do, how we organize healthcare from really tiny practice to a really large-scale projects. So let me start first asking you, does software save lives? I guess, in the end, you're all here because it's a case for automotive, for the disaster management, and also we saw it, surgery, medical, emergency room. Yeah, damn yes, software saves lives. What about online appointments? I think, yeah, you have a discussion if this is really the case. My answer to this is 372. So that's not only the numbers of decreasing of deaths in automotive in the last 5 years in Germany, but it would be also saving the life in the first half year of Corona if they do it in a proper system. And so let me show you it in an experiment. We take 16 candidates, give the candidates all the same resources, the same medication, let them work on the same topic with the objective function, fastest delivery as the best health outcome, and with the input variables of organization and technology. As you know, we have in Germany 16 federal states. They all vary in size, small to large. They had also a different approach to vaccination. Was it a centralized, really centralized stations, or was it decentralized, more smaller entities for vaccination? They had different providers. We were the ones who were proud to cover Saarland. They all had a different platform for this. As we seen in a study, there had been no size effect. So it doesn't matter if they are small or large, was the same output. There had been no effect on the system, say it's decentralized or centralized, but there had been a state and a provider effect. This was, as you see also here in the news release, Saarland. And so we asked ourselves, was it just pure luck? Was it accident? And we saw it like in the numbers, it was not accident. Saarland had not a good start. They were really in the lower part. They had to recap it. What you see here is a cumulative additional vaccination rate. And so in the end, they were of 180 days, over 70 days, the number one in terms of really delivery of vaccination. And that was also due to our continuously optimization of the health platform. So we really could achieve, like here you see, a significantly cumulative additional vaccination rate of 8. So whenever 100 were vaccinated in Saarland, we achieved 108 vaccinated. We could also show that there had been 14% overperformance, significantly, really on a high significance. Reuters reported also that there had been 2 months earlier freedom from lockdown. And in terms of organization, it was also the communication, the personalization, the data management, and in terms of technology, also our focus really on the usability and the click flows of the platform. So, of course, it's not the online booking alone. It was the whole digitization of the process, really, from the start of the admission, the communication, reminders, QR check-ins, the workflows with all the forms, waiting lists, the allocation to the vaccination cabins, the documentation with employee ID scan, with scanning of the vaccination code, to the reporting, to the online government institutions, and also to the discharge of the green certificate, which we integrated from IBM. So it's a whole approach, and this is one example, but which we also see in other ones, say it's hospitals, practices, or other health entities, which we do. So in the end, we come to the variable, it's not technology alone, but it's also not organization alone. It's really the interplay of both, which in the end saves life and which makes the best patient journey. And that is what we are doing as Samedi. We are organizing health. And so we are really concerned about the special triangle of the healthcare sectors, from patient, payers, providers, to reduce costs and also increase quality and service. This is what we do through the whole chain, from the patient to the GP specialty, clinic, rehabilitation with the insurance company all together, with now over 80 products and modules from the online booking, but also check-in, anamnesis files, signing of the treatment contracts, the internal resource planning, referral network, medical record, also telehealth and payments for additional digital business models for hospitals and clinics. So we're doing it since 15 years, from very small projects, the practice clinics, to over large hospital chains like Asklepios, but also Charité and other ones. And also since the last years, we're doing it for even federal states. As you've seen the success of Saarland, we also had the whole federal state of Baden-Württemberg. We're now also doing Bavaria. So that is our route, really from tiny to small. And we're doing this with a really special focus on security, with all end-to-end encrypted, with interfaces to over 40 practices and to all hospital information systems in Germany, and with our strong focus on the process excellence within the institution. So we're doing it with 150 employees over 3 groups, 36 dedicated teams for every special need which we encounter in the project to make it really happen. And in Germany, we are one of the market leaders in e-health. So we have over 45,000 professionals using our system from 9,000 institutions, managing over 35 million patients. And in Germany, we have now the Hospital Future Act, where the government set out 4.3 billion for finally digitizing the hospitals. And there we're also now one of the leaders in one section, namely the Section 2 patient portals, where we won most of the hospitals, or in terms of counting beds, compared to the other ones. So that is a route of the last 15 years, where we started to develop the product, make it really perfect for the special requirements of the healthcare sector, establish it, build a profitable company, scaled it in the last also 7 years. And now we are also in the growth phase, looking also for a partner to accompany us on the mission to really save the healthcare system, save lives, our lives, the lives of our families and the people we loved. So looking forward to any further talks, and that was it from my side. Thank you very much.